Dr. Wahls, thank you so much for coming on to the show. First of all, I'm very grateful to have you on here and looking forward to our conversation.
Thank you for having me.
I would love to start with your miraculous story of
Yeah,
recovery. I wanted to know about more about that and how you got to the place that you are right now.
sure. So I'm a physician, internal medicine, very traditional internal medicine doc. And then in 2000, I developed weakness of my left leg, and went to see my colleagues. Ultimately, got into neurology, got an MRI, spinal tap, and a diagnosis of relapsing remitting multiple sclerosis was made. I'd had a history of dim vision 13 years earlier, and I'd had 20 years of electrical face pains that were diagnosed as trigeminal neuralgia that had been getting progressively worse. I did my research. I found the best MS center in the country, saw the best physician, took the newest drugs. 3 years later, I've converted to secondary progressive MS. So there's no more relapses. There's only a slow, relentless decline. I'm in a tilt-recline wheelchair. I take mitochondria, a form of chemotherapy. Then I take tizabri, a new biologic drug. Neither one of those help. Then I'm switched to Cellcept. And that's when I'm asking myself, am I really doing all that I can? And that's when I start reading the basic science. And I begin thinking that mitochondrial dysfunction is what's driving disability. I create a supplement cocktail for my mitochondria. And I figure out that my fatigue is not quite as severe if I'm taking my supplements. But I'm still, getting progressively worse. I
Mhm.
discover a study using electrical stimulation of muscles in people who are paralyzed. And I ask my physical therapist if I can try it. He says, yes, he can grow stronger muscles, but he doesn't know if my brain can talk to those muscles because of the MS. But he gives me a test session. It hurts bad, really quite bad. But when it's over, I feel great. My therapist says it's because of the endorphins. We add electrical stimulation of muscles to my workout, which is a very simple 10-minute mat exercise program. Because if I go longer than that, I can't get off to work. And I'm still working. I'm still seeing patients with the residents in the resident clinic, and I'm staff, and I'm on the institutional review board reviewing research. And then I had this really big aha. Like, what if I redesign the paleo diet that I've been doing already for 5 years based on the supplements that I've discovered were really good for mitochondria? And so I do some more research, figure out where those ingredients are in the food supply. And I start this new way of eating December 26th of 2007. At that time, I'm so weak I cannot sit up in a regular chair. I'm otherwise in a zero gravity chair with my knees higher than my nose because I can only sit up about 10 minutes, which meets the definition of being bedridden. I'm beginning to have, and my face pain is getting relentlessly worse. I'm beginning to have brain fog. It's very clear to me I'm on track to become ultimately bedridden by my illness, demented likely by my illness, and quite possibly dying with intractable pain.
Mm.
So a very grim future awaits me.
Mhm.
Uh, I redesigned my paleo diet, start this new way of eating. And by the end of January, I realized my energy is improving. My mental clarity is improving. My physical therapist says, Terry, you're getting stronger. Let's have you advance your exercises to 10 minutes twice a day. And that's 15 minutes twice a day. And that's 20 minutes twice a day. And that's 30 minutes twice a day. And, at the end of February, I start walking at the VA hospital using 2 walking sticks. They haven't seen me do that in 4 years. And then with 1 walking stick, and then with no walking sticks. And then Mother's Day weekend, I tell my family, and this is 2008, about 5 months into this new way of eating, I want to try riding my bike. We haven't, I've ridden my bike in 6 years. We have an emergency family meeting. My wife, Jackie, tells my son, 6'5", Zach, you run alongside on the left. She tells my 13-year-old daughter, Zeb, you run alongside on the right, and she'll follow. And we get into position. She gives me the all clear, and I push off. And I bike around the block. You know, that big 16-year-old boy, he's crying. The 13-year-old girl, she's crying. Jackie's crying. And I still begin to cry when I relive that moment, because that was when I understood, like, how much recovery might be possible. And I biked a little bit further every day. And then in October, Jackie said, honey, I just signed you up for the Courage Ride. It's 18.5 miles. However far you go, we'll be fine. And so we all go to do the Courage Ride. And once again, when I cross that finish line, we're all crying. My kids are crying, Jackie's crying, I'm crying. I always cry when I relive those moments, because I had accepted that what I was taught in medical school and in residency, what my physicians had all told me, that if you have secondary progressive MS, functions once lost are gone forever. And so, as a part of my coping mechanism, I had let go of the future.
Mm-hmm.
And it wasn't until I got on that bike that I was like, wow, who knows how much recovery might be possible. And so now, so that's back in 2008. Now it's 2023. I keep working out. I am older, quite a bit older now, but I can hike for hours. I can bike for hours. We went to the Rocky Mountain National Park this spring, and
There, by the way, yeah.
it's just so beautiful. And I was hiking for hours there. In fact, we went up to 12,000 feet, and I'm hiking for hours at 12,000 feet.
Wow.
That was not something that I would have considered remotely possible in 2007 or 2009 or 2010, but I kept at it. And I am so grateful that my life changed, and that I didn't give up. I was like, okay. I asked myself that very important question: are you doing all that you can?
That's utterly remarkable that you went through that and persevered. Something that they said MS was irreversible at that time, and I still, if I'm not mistaken, it's still considered.
That's still absolutely still the dogma. If you have secondary or primary progressive MS, once you hit the progressive phase, there are treatments that they give you to try and slow the decline. There are no FDA-approved treatments that restore function.
Still to this day.
Still to this day.
Amazing. Not amazing that's the case, but amazing that you have this amazing story behind you. I wanted to know, first of all, thank you all so much for sharing that, just because I got a little emotional myself hearing that story from you. And I wanted to know about you mentioned mitochondria,
Mm-hmm.
and I would like to know a little bit more for if you can put that in layman's terms, like
Oh,
what is
sure.
mitochondria and how it affects our biology.
So, life first began about 4 billion years ago. That's the earliest form of life. About a 1 billion years ago, there were ancient mitochondria or ancient bacteria that could utilize oxygen more effectively. And they were engulfed by bigger bacteria that couldn't use oxygen very well. This new organism that had the mitochondria that could use oxygen really well thrived and grew, and would ultimately evolve into multicellular organisms that are the forerunners of animals, primates, and humans. And in every one of our cells, these mitochondria are ancient bacteria that can take the oxygen and use the oxygen to generate ATP which is the molecule that we use, like the currency of biology, to help us make the biochemical reactions happen that we need to run the biology of life and to build things and to make things. And if you can use oxygen, you do that much more efficiently than if you don't use oxygen, which is how we were able to evolve into multicellular beings, into mammals and primates, and of course, ultimately humans. Which means you want your mitochondria to be really, really efficient and healthy so they can have plenty of money to spend on the biology of life. If you don't have enough money to spend on the biology of life, you got to be chintzy. You got to, just do just a little bit of the biology of life, which means you won't have mental clarity, you won't have energy, you'll be cranky because most of our brain is trying to calm ourselves down so we aren't too cranky. All of that requires a lot of biologic money, or ATP. And it's the mitochondria that makes the money for us.
Got it. Thanks for that explanation. I certainly got a lot out of that. When it came to your recovery, I wanted to know what is your personal uh, definition of neuroplasticity, and how did that affect your work?
Ah, sure. So, have you broken a bone, Brody?
Oh yeah.
Oh, yeah, me too. I've broken bones. So, you've probably had your arm or leg in a cast.
Oh yeah.
Okay. And many of you listening have probably had your arm or leg in a cast. And when the cast came off, and you looked at the arm that had been in the cast and the arm that was not in the cast, you could tell that the arm not in the cast was normal size, and the arm that had been in the cast was now very skinny and small and weak. This is an example of the plasticity of the body shrinking away when it's not being used. Our brain is the most expensive real estate we have in us as an organism. And so if it's not being used, your body's going to take away from it. If it's being used, your body will build it. So when your arm or leg got out of the cast, hopefully you got sent to physical therapy to get some exercises to rebuild the strength in that arm and leg. And when you did that, Brody, did the arm muscle size and the leg size get close to the same between the broken and the unbroken parts?
Eventually it did.
But it took a lot of work.
Sure did.
Yeah. Same here. I've managed, I was a martial artist, so I broke a bunch of bones doing that. And I was a skier, and I broke a few things doing that. And I'm a jogger, and I've broken a few things doing that. And the older you get, the more work it takes to, get everything back symmetric. But we can do it. And in your brain, we can do that. Now, you see, I have white hair. So when I went to medical school, which is a few years ago, I was taught that you lose brain cells, nothing comes back, and there was no conversation about neuroplasticity. We now know, in fact, that my brain is capable of building new connections, of building new myelin, and in fact, building and repairing lost brain cells. And if I decided I was going to learn something new, learn to juggle, learn a new language, and we do these really detailed MRIs of my brain, we can see that my brain gets bigger in that parts of my brain that's being used. And if I quit doing something, that part of my brain that no longer is doing in charge of that activity gets smaller. So we have neuroplasticity in reverse, where things shrink. And we see that in our body. Things will shrink if you don't use them, or they will grow if you use them. That is the element of neuroplasticity. And that is true literally for every part of your body. Because, keeping life going is an energy intensive task.
Hmm.
And we are going to allocate resources to where they're being used and to take resources away from parts of my body and brain that are not being used.
That's a fantastic explanation. I actually have this shirt on. It says "Use it or lose it," and that knowledge of neuroplasticity was very instrumental in my recovery from brain surgery and TBI, and epilepsy. And I wanted to know, at the time of your recovery, did you have that knowledge of neuroplasticity, or you just said, "I'm going to do this," you know?
Well, and what I want people to know is all of this was sort of incremental learning. Yeah, when I was first diagnosed with MS, I read everything that I could. It was very upsetting because there's no hope of recovery. It's a progressive disease. My
Right.
family said, "Terry, you got to stop reading. You're just getting upset. We'll get you the best docs." So I didn't read for 3 years. And I hit the wheelchair. Like, well, screw that. I know how bad it's going to be. Really terrible. I'm going back to reading.
Yeah.
And I focused on supplements, which helped a tiny bit. And I did the paleo diet. Didn't really help, but at least I felt like, okay, I'm doing something that's scientifically plausible.
Hmm.
Then I read that paper about electrical stimulation of muscles in people who are paralyzed, who are never going to walk again. And so this was about maintaining their muscles and their bones, even though they weren't going to walk. And I thought, well, that's probably good for me. Still no conversation about neuroplasticity, but I did that. And what I could tell was it was doing amazing things for my mood and mental clarity. And I'd been doing it for 3 months before I could see any change in strength. So it wasn't quick. And I had to start with small doses and gradually work my way up. But in the first session, I could tell it had done something remarkable for my mood. And in the first couple of weeks, like, okay, it's certainly doing something for my mental clarity. As I had been doing it, and then I was started doing a case report, a case series, and my chief of medicine had me start doing what's called a safety and feasibility study to see if other people with progressive MS could implement this intense protocol that I have. And we were presenting it at some big neuroscience international meetings. And then I'm like, so how is this working? And I'm looking for the mechanisms. And I began to see that exercise, electrical stimulation of muscles makes, if you're doing that, you have more brain-derived neurotrophic factor.
Mm.
And I thought, wow, no wonder I love East. No wonder I so love the East Stem. And anytime I attempted to decrease the amount of time, man, I did not like it. I really wanted to have a lot of electrical stimulation every single day. And then, so I've already been doing it about 10 years. Then we're beginning to see a little more conversation that there is neuroplasticity, that we can, in fact, grow our brains with exercise, with cognitive learning, with motor learning. And that it's like, wow, wow, wow. And of course, now it's quite obvious when you look when we think of the cast, your
Hmm.
arm in the cast, just out of the cast, and the other arm that was never in the cast. That when you weren't using your arm, everything shrunk. If you're not using your brain, it's going to shrink. If you're using your brain, it's not going to shrink. Now, will still have age-related changes, and we can slow that down
Mm.
by using your brain and having a great diet and exercising, doing all of those things that I teach in my longevity programs. But so much that we can do.
I love it. I love this conversation. And it wasn't just necessarily the nutrition, it was electroceuticals. Maybe is that how you pronounce
Well,
them?
that's an interesting way to think about it. Is it electrical? stimulation of muscles, exercise, targeted supplements. I also did meditation.
Hmm.
We'd been doing the paleo diet. It was the combination of all of that that was so powerful. And of course, my colleagues who were trying to get that first paper published, it was enormously difficult because it was such a new concept that, we did this very comprehensive rehabilitation program, had remarkable results, but the criticism is, well, we don't know what the mechanism is. And I'm like, well, but the study question was, could people do it? Did we hurt them? And what was the effect size? And we were quite surprised when we saw that the effect size was very, very large. In
And
the first study, the size was only 10. And then the second time we did it, we had 20. Again, very large effect size.
would you, coming from a medical background as you did yourself, what do you believe as far as combining Eastern and Western
Well,
philosophies together, or
so
where do
what
you stand on that?
I think there are some wonderful insights from Ayurvedic medicine, from the Indian subcontinent traditions, from traditional Chinese medicine, from Native American uh, um, understandings of health. Absolutely. My my training, most of my training is in the area of functional medicine, where here the concept is I'm going to look at the microenvironment for your cells and try to optimize that as thoroughly as I can. And then we'll have to watch you closely, because if the cells can do the biology of life more correctly,
Hmm.
and you're on prescription meds, we'll have to watch you closely, because it's quite possible that the dose of prescription medicines that you need is going to change. In my clinical practice, when I was at the VA, we would have to often reduce medications, reduce the dose, and often eliminate the medication as people recovered. And so you have to watch closely, and you don't know how much recovery or how rapidly things will change.
Hmm.
And I explain my, I'm not treating chronic disease, I'm creating health.
Ah,
And
yeah.
as we create more effective biology in you and better health for your cells, we'll have to watch, because if you're on prescription meds, we're probably going to have to be changing some doses as we go along. So I want people to work with their usual medical team who manages their disease states. We'll work on creating more health, and we'll have to have a close communication with their medical team who's treating the chronic disease to adjust medications as appropriate.
I got it. And when it comes to your, what would your personal definition of health and personal definition of disease be?
Well, so I think of health and vitality. So for your mental health, are you having joy, mental clarity, a stable mood, and are you happy?
Hmm.
And for your physical health, are you feeling plenty of energy, plenty of endurance, an absence of pain, a sense of well-being? Now, disease is that then from I'll put on my internal medicine hat. So you'll come see me and you'll have a bunch of symptoms of some sort of mental discomfort or physical discomfort, or there may be a sense of difficulty with managing your body in some way, which might be motor discomforts or bowel or bladder issues, etc. So we have symptoms, And then I'll talk with you. I'll do a little interview. I'll do a physical exam. I may say, you know what, Brody, let's do some blood works, maybe some urine tests. And then, well, I'll gather that data. I'll bring you back and say, okay, I'm putting your story, the exam, and the lab tests together. And now I have a diagnosis. And here's the treatment, the FDA approved treatment or the standard treatments for that symptom or that disease state. When I take my internal medicine hat off and I put on my functional medicine hat, I'll say, so here are your symptoms. I'm sort of thinking about that. This sort of tells me how your immune cells are working, how your gut's working, how your mitochondria are working, how your ability to remove toxins are working, maybe your hormone balance, how that is. And then I'll ask you to tell me more about your eating, what you generally eat, what your movement patterns are, your stress level, your connections with other people, your purpose in life, your spiritual and religious life. And then, so I'll gather all of that and I'll ask you about the timeline of your health events, the timeline of your major life events. So this takes me a couple hours. That's a
Yes.
lot of stuff that I want to know about you.
Mhm.
And then I will say, well, Brody, I want you to keep seeing your medical team for your medical diagnoses because I'm not treating disease here, but I'm going to help you create more health. And here are the big problem areas that I see. And here are the various interventions that I think will be very impactful. And I might rank order. Here's the most impactful things that we could do to easier, but maybe less impactful.
Mhm.
And then I ask a question. Okay, there's a whole program I laid out. Tell me what you think you could do. And you'll say, and what you learned today. And then you'll tell me that I was either a very good teacher and you understood well, or you don't, I did not explain very well. You don't understand what I'm talking about, so I have to do a better job. And then you'll tell me, like, I'm all in. I could do this complicated regimen. Or you might say, Doc, I need something, I need a little smaller next step. And that's okay too.
Mhm.
And so I have some folks who are ready to go all in on a really big change. Others, we have to work on much smaller next steps.
Totally. Totally. That when it comes to baby steps, they can be helpful because baby steps really add up over time. I
Absolutely. And one of the things that I've learned, and it was my patients at the VA that taught me this, Brody, is, um, we'd have this wonderful clinic, the Therapeutic Lifestyle Clinic, and I would have skills classes. People could come in every month, and we'd have guest speakers. We had movement professionals, nutrition professionals, chefs, health psychologists teaching wonderful classes. The most impactful classes were actually by the health psychologist. And because I came to realize that people have to have a reason to want to do the work of making these changes
they sure
because
do.
we're addicted to processed junk food, sedentary behaviors, and it takes work to make new habits. And you may experience some withdrawal if you stop sugar and things that are bad for us. So admitting that it was hard and then helping them grow the motivation to do the work. And so what I learned was to ask, and this was a really brilliant question. If there was a house that smoke was sort of rolling out of the windows, it's beginning to be on fire, is there someone or something that matters so much to you that you would run in even over broken glass to save? And of course, the most common answers were my grandchildren, my children, my spouse, my parents, occasionally a sibling, sometimes a dog, sometimes a cat. Every now and then it was, precious family heirlooms, or it might be precious works of art that they're working on or a manuscript. but nearly always it's people or pets. And then the next question is, would you be willing to to work at improving your health so you could be there more effectively for this person or your pet? And they're like, well, yeah, I would like to be able to take my dog for a walk again. I would like to be able to get on the floor and play with my children and my grandchildren again. Okay, so now we have a reason to do the work. Then the next question is, so in what domain do you want to work? Your nutrition, meditation, movement. Okay, and then now we start working to identify what's the next step that they'd like to go on. And once I learned to take that sequence, it was so much easier for our people to be successful.
That's fantastic. That because we all do need something that motivates us in a story. It's like the stories that we tell ourselves that are
Absolutely.
so very important in language patterns and um, really what's going on between our brains is so important. I re- I noticed that on your interview with Kevin, you guys discussed about people being angry with you for giving false hope. Can you talk about that? Because
Yeah.
to
You
me,
know,
when I was sick, all I wanted was some hope.
hope.
Hope is very powerful.
In 2008, when I first started telling my story, and I talked at the organic grocer, and then some churches and religious communities, community schools. The local MS chapter wanted me to come speak. So, yeah, of course. And so the clinical advisory committee interviewed me, wanted to hear what my message was. And the neurologist thought it was terribly dangerous because people would hear my story and they would refuse FDA approved drug treatments. Now, mind you, I never said don't take the drugs. I never said stop the drugs. In fact, I'd say don't stop the drugs. Talk to your neurologist about the drugs. Talk to your primary care about these radical things known as vegetables. Ask for a referral for meditation. Ask for a referral for physical therapy. But they said they thought I was dangerous, so they banned me as a speaker, the National MS Society. So I just kept going where I was invited. My physician colleagues at the VA complained. I had to go meet with my chief of staff and we discussed my message. And he said, okay, Terry, you're going to have to go talk to the complementary alternative medicine clinics. You can learn how to talk about this safely. And that's where I learned to stress more thoroughly that I'm creating health and that we want the primary care, internal medicine, and specialty team to keep treating the disease states using conventional treatments. We'll create health and then monitor medication use and make adjustments accordingly. That message was well understood. And fortunately for me, the chair of medicine and the chief of staff at the VA wanted me to start doing clinical trials, testing could others implement what I had done. And so we've done multiple trials and published them in peer-reviewed scientific journals and kept having more funding to do more rigorous trials. And my messages slowly became less and less controversial.
Hmm.
And, we're getting into higher impact scientific journals. We had something called a network meta-analysis, which is a special kind of study that combines multiple studies with a common outcome. And then you can, through a specific statistical analyses, rank order them from most effective to least effective.
Mm-hmm.
And so we combined the 12 dietary studies that looked at 8 different diets: Mediterranean, low fat, Paleolithic, anti-inflammation, ketogenic, fasting, calorie restriction, and usual diet.
Mm-hmm.
And what they found was for reducing fatigue, paleo diet, Mediterranean, and low fat diet were the only 3 that were consistently effective.
Mm.
And the paleo diet was about 40% more effective than the other two diets, Mediterranean low fat. And then for improving quality of life, again, paleo and Mediterranean were the only two diets that were effective. And the paleo diet was more than twice as effective as the Mediterranean diet. And that was in neurology, the highest impact journal
Mhm.
that publishes research and clinical commentary on the care of the MS patient. And they had an editorial that said, there's now good evidence that diet really matters, and all patients with MS should be sent to a nutrition professional who can help them improve their diet as a family.
Beautiful, beautiful that you got in the really, really high ranking
That
journal.
was like, oh my God, we were so excited.
Yeah, that's a big one. That's a big
That's a
win.
very big deal. Yeah.
Yeah, that's amazing to hear. When it came to your recovery with MS, and you also mentioned the trigeminal stuff, I had some TMJ pain, and that was some pretty high ranking pain in my opinion.
That is, yeah.
But I guess my question for you is, how do you find how do you find a lesson in the pain, or how do you find
Ah,
a teacher in the pain instead of just looking at it as pain?
yeah. I tell my patients that pain is actually a gift. It can be a very useful tool. In my case, when my sensation on my face begins to be a little abnormal, and if the twinges start, which rapidly get to electrical, get to horrific, then I reflect on the previous 24 hours. Were there any triggers, toxin exposures, toxic events, potential food exposures that I think might have triggered the pain? And then the second thing I look at is, how am I doing on my self-care routine? And over time, and I teach this to all of my patients.
Hmm.
If you have pain, this is very helpful. What were the triggers that maybe you could identify? And how is your self-care routine? Take notes to the level that you're willing to do. And over time, you will likely identify the foods that are best for you, the activities that are best for you, and what you may find. What I can tell for me is gluten, dairy, eggs trigger my pain. Uh, Toxic exposure. So if do too many flights, that's a problem. If I am exposed to a terrible air quality, that can be a problem for me. So with the Canadian wildflowers, like I was very careful to stay inside, away from that, because that can be a problem. Stress, severe stress, that can be a problem. A virus, getting a viral infection can trigger that as well, as can a bladder infection. So I've been able to identify what are the triggers that will activate my pain. For people with MS, uh, they often have a sensory disturbance. And as I teach them, like, okay, this is a signal for you that tells you the inflammation is increased in your brain, your spinal cord, your cranial nerves. Look for potential inciting triggers. And I list the common triggers. If you have a skin condition, psoriasis, most of those folks can say, like, oh yeah, I can recognize there are triggers that cause my psoriasis to flare. Pain is helpful because most of us would rather have less.
Yeah, that's a true, so true. And I would love to refer people that are listening to the current studies that you're doing. And
Yeah.
yeah, can you talk a little bit more about those?
Yeah. So there's two things I want people, well, several things. Go to Terry Wahls, Terry, Wahls, WAHLS.com/MS study. There's a little yellow box in there, or actually a big yellow box. Take the survey now, put in your demographic data. You'll be part of a database so that we could contact you for future studies. But sometimes we do survey-based only studies. Right now, we're also looking for people with relapsing, remitting multiple sclerosis who between the ages of 18 and 70 who live in Mexico, the United States, or Canada, who'll come to Iowa and get baseline assessments. Then we randomize you to get either the ketogenic diet, the modified paleo diet, or you continue on your usual diet. You return in 3 months for repeat blood work and some clinical tests, and then again in 24 months. You'll get an MRI at the baseline and at 24 months. No contrast in that MRI. We're recruiting 156 people. It'll be one of the largest, longest studies that we've ever done, that anyone has done in the study of MS. So if you have MS or you have an autoimmune condition, please get your name on our patient registry so we could contact you about future studies. Tell your friends, your neighbors, and colleagues with MS, get them in. We have room for about 40 people left, and we'd love to get you in so you can be part of our study.
I love it. I love it. Please do it if you're interested. And I wanted to, I say, so there is hope. There is hope with MS, but there are other pathways, and I believe that you're
Yes.
a proof of that in a way.
It absolutely, it is perfectly fine to take disease-modifying drug treatments and be in the study. It
Mhm.
is fine to do disease-modifying treatments and diet and self-care. I think everyone should do diet and self-care. It's just to have healthy aging.
Mhm. Oh, I love that. I wanted to leave you with the last word here, Dr. Walls. Thank you so much. It's been an honor and a privilege. If you could just give the
Well,
listeners something to take
yeah,
home with.
a couple things. Go to my Instagram page and follow me there, Dr. Dr. Terry Wahls, Terry Walls, Wahls. And we have a course that we run periodically on remyelination, which is fabulous. We have links to that in our at the bio in Dr. Terry Walls dot or Dr. Terry Walls in Instagram, and then on my webpage, terrywalls.com.
I love it. I love it. Thank you so much for coming on. Thank you for anybody that's listening. And I hope you all have a fantastic day.